Thank you so much, Dr. Jill, for joining us on World Peace Channel 1. It's a joy to meet you over the internet. I know you're in California and I'm sitting in New Jersey right now. So could you tell us a little about yourself and your career?
Yes, thank you so much for having me. So, I am a pediatric orthopedic surgeon and I work at Valley Children's Hospital, which is a children's hospital in Madera, California, in the Central Valley. It's the only children's hospital between LA and the Bay Area. So, we have a wide catchment area of more than 6 million people and a huge landmass. So, we see thousands of children every day. And because we have kids from several hours away who need care, sometimes we do outreach clinics, which is what I'm on my way to doing this morning.
That's very exciting. I'm sure you're making a huge difference in so many lives of kids. About how many patients do you see in a week?
Good question. It depends a little bit on the week because I have a wide variety of clinics that can be very busy versus days in the operating room where I may treat, 4 or 5 children. Typically, in a full day clinic, I will see anywhere between 30 to 40 patients. So if I have usually 2 or 3 clinics in a week, that's about 100 kids.
That's amazing. Improving the lives of 100 kids in a week. That is so cool. So could you tell us how you became inspired to become a physician and then an orthopedic surgeon?
Yes. So it was a long process for me growing up, partly because I wanted to explore a lot of different areas before I made a decision on my career path. And I'm a very independent person. So I didn't want to kind of pigeonhole myself in one area too soon. But I always loved the sciences growing up. I took lots of extra science classes. I loved biology, chemistry, and I really gravitated toward the sciences when I got to college. I started volunteering in the hospital to learn more about it, as well as in research labs. So I worked in a genetics lab as an undergrad. And I thought that the science behind it was very interesting and learning about the human body. And then in the hospital, you can learn how to apply that knowledge to help people. And I just thought that was a fantastic way to use that knowledge. So I ended up going to medical school. In medical school, again, we rotate through as many areas of medicine as possible in order to try and make a decision about what you want to do. And I've always been a very athletic and sporty type person. I've played most sports and I like using my hands and being very active. So I gravitated towards professions that had a lot more procedures or surgery where I could be hands on. And I ended up doing a rotation in orthopedic trauma where, I dealt with people in car accidents. And I remember my very first surgery, we had a woman who was in a terrible car accident and had multiple fractures, and we're all working on different fractures. And I just thought, this is so amazing how I can put somebody back together and get them back to their life. And and then when you boil that down to what type of orthopedic surgeon you want to be, to do that for a child is just amazing. And kids, they want to get out and play and they want to have fun. And I can make a huge impact in a child's life doing that. So that's how I ended up here.
Wow, to literally put a person or especially a kid back together, what does that feel like to do that?
Well, for me, it's a lot of fun. I take care, and now I take care of a variety of orthopedic problems in children. So, our most common ones that we think about are trauma. A kid falls off of monkey bars and break their arm. And for me, that's an easy problem I can fix and make a huge difference in their lives and get them back on the playground in a matter of months. Uh, and, I can walk parents through that and get kids back into what they enjoy doing. I also take care of a lot of kids with neuromuscular type disorders. So, kids with cerebral palsy and spina bifida that affect their arms and legs and may make a difference in terms of what they can and can't do in their daily life. And so, my goal is unfortunately, I don't have a cure for that problem, but I can help them to overcome barriers and burdens and be able to enjoy those same activities that their peers are enjoying, whether it's swimming or soccer or basketball. So through that, I also run the adaptive sports program at Valley Children's Hospital.
That's beautiful. And could you tell us about your new title?
Yes, so I'm Dr. West Coast America 2024, and I'm competing this October for Dr. America. I'm very excited about that prospect. And, you know, Dr. Haley Nelson, who's the current Dr. World, is also at Valley Children's. And she and I have gotten to know each other over the past year, and she's convinced me to join the Dr. World Productions and run for Dr. America. Part of it is my platform, which is Safe Sports for All, and being able to increase awareness that, first of all, everybody should have access to sports and be able to play sports and participate. And I'm the director of our adaptive sports program, so I'm trying to raise awareness for our program. It is a nonprofit organization that runs completely on donations from the community and volunteers from the community. So that's a huge reason that I'm part of this pageant. And then the second reason is, you know, the safe sports portion. As an orthopedic surgeon, I see all of these kids who are have injuries or trauma, and a lot of it is from sports, and many of it can be prevented. So I'm trying to get more information out to our parents and our community and our coaches and our schools so that kids can continue participating in sports and having fun, but also do it safely so we can avoid some of these injuries.
Well, congratulations on your new title, and it's so exciting that you will be competing for the Dr. America title. If you were to be crowned as Dr. America, that would give you a huge amount of influence. You could go on TV, you could go on the radio. What would your message be?
Oh, thank you so much. Again, I just want to promote my platform, Safe Sports for All. I think that there's so many communities out there that could benefit from this information and about ways that we can be an advocate for our children so that they can play sports and be safe while doing that. And I'm already trying to reach out to our general community by giving lectures and information on how we can start adaptive sports programs in our own community so that every kid can participate, and how we can do that safely.
That is so important. Sports are important in the development of kids and adults, you know. We adults still develop and all that. And it's just, your work is so important. So in conclusion, in our interview, do you have some advice for parents on how to keep their kids safe when they're playing sports?
Good question. So some of the most common things we see are overuse injuries that can be prevented by making sure that your child gets breaks in between seasons and they're not playing a single sport year round. So we recommend having a variety of sports and a variety of activities for children to participate in. And the second is making sure that they have the right safety equipment and things needed in order to participate in that sport so that they're safe while they're playing.
That's excellent advice for parents. Thank you so much. And we at World Peace One are really grateful to have met you.